When the patellar ligament receives a gentle blow between the kneecap and the tibial tuberosity, stretch receptors in the quadriceps femoris muscle are stimulated. The impulses that these receptors generate are carried to the spinal cord by sensory neurons within the femoral nerve. Within the spinal cord, the sensory neurons synapse with motor neurons, which conduct motor impulses back to the quadriceps femoris muscle, and it contracts, resulting in a knee-jerk response. This is an example of a spinal reflex, and is one of several such reflexes that physicians will attempt to elicit during a physical exam. The clinical value of the reflex response is that it tells the medical practitioner that the involved sensory receptors, sensory neurons, motor neurons, and a particular segment of the spinal cord are functioning normally. The physiological purpose of this particular reflex is it keeps the knee joint from collapsing when it is suddenly subjected to an increased load.
Hi, I'm Mike Shively, and welcome to Introduction to Anatomy and Physiology. Today we want to talk about sensory receptors, reflexes, and we want to talk about the autonomic nervous system a bit. Has anybody here ever grabbed a hold of something too hot?
Mm-hmm.
And you felt heat and you turned loose of it if it was really hot? Or something, somebody has come up behind you and stuck you with a pin just for fun, just to see you jump? You ever have those kinds of experiences? If you have brothers and sisters, you have those kinds of experiences sooner or later. I want to talk a little bit about sensations. I'm going to talk about sensory receptors. And when we say sensations, we're talking about the kinds of things that we perceive. And we can actually divide those sensations into two big categories. We can divide them into a group that we call general sensations and a group that we call special senses or special sensations. What kinds of things are included under the concept of general sensations or the general senses? What do we think of? Susan?
Pressure, pain, touch, those kinds of
Pressure, pain, touch. Anything else in there? Starley?
Oh, heat and cold.
Hot and cold. Those are general sensations. And when we say spatial senses, what do we think of? What kind of things? Adam?
Taste, smell, vision, hearing.
Okay, taste, smell, vision, olfaction,
And hearing.
hearing, and Seth.
Maybe a sense of equilibrium.
Equilibrium. Let's take a look at a graphic that summarizes what we just said. The general sensations, we can, the words that we use to describe them at least are hot, cold, pressure, pain, touch, those sorts of things. And the special senses are vision, audition, or sense of hearing, equilibrium, i.e. sense of balance, that sort of thing. Gustation is a fancy word that refers to taste, and olfaction referring to the sense of smell. These special senses are carried by cranial nerves, certain of the cranial nerves. Now, many of the cranial nerves are also involved with these kinds of things, but spinal nerves are limited to the general sensations as far as the sensory information that they carry. Now, when we have a sensation that we perceive, the general idea is we have to have that information converted into a sensory impulse by a specialized cell or group of cells that we call a sensory receptor. And the sensory receptor simply generates the impulse. It does not transmit the impulse on into the brain or spinal cord, but it generates it. Once it generates that impulse, it synaptically transmits or sends the impulse to a sensory neuron that's located right there. Then the sensory neuron actually carries the impulse in. And regardless of what we're ultimately going to interpret this sensation to be, the impulse is the same. In other words, you can't look at the impulse and say, well, that one's going to be interpreted as hot, or that one's going to be interpreted as cold. The way the body manages to do that is if it comes from this kind of sensory receptor, then the sensation when it's interpreted is going to be hot. If it comes from this kind of sensory receptor, the sensation is going to be pressure, or the sensation is going to be something else. You understand what I'm saying? So that The actual impulse, though, as it's going up the various sensory neurons that are involved, is exactly the same. So the impulses are the same. It depends on what particular sensory receptor generates the impulse as to how that particular impulse is interpreted when the impulse gets into the brain. And there are lots of different kinds of sensory receptors. Let's take a look at a graphic that just summarizes a couple of concepts about them. They convert stimuli to nervous impulses. In other words, they are energy transducers. There are many different kinds of sensory receptors, and each one is stimulus specific. In other words, the ones that respond to light don't respond to any other stimulus. The rods and cones in the retina of the eye, you can warm them up and cool them down. Within physiologic limits, they do not generate impulses except in response to light. And the other kinds of sensory receptors are similarly stimulus specific. Once they generate the impulse, they synapse with the sensory neuron, and the sensory neuron then carries the impulse into the brain or the spinal cord. So that's how the sensory information gets from the peripheral regions in the body where the impulses are originally generated into the brain or spinal cord. Now, Adam, do you have a question?
Yeah, if you go outside certain physiological limits, will they fire? I mean, what I'm asking about is like if you get a lot of pain when you see flashes or stars.
As a matter of fact, if you exceed certain physiologic limits, you can get sensory receptors that will generate impulses that they wouldn't normally respond to that particular stimulus. I don't know if any of you have had the experience of maybe getting hit pretty hard in an eye. I played Little League Baseball one time, you know, back in the previous century or two, and at any rate, I got hit by a foul ball. It bounced off my bat, one of the few times I ever actually made contact with the ball, and it bounced up and hit me in the eye. And it hit me pretty hard, and I saw colors, you know, as a response to that particular. In other words, pressure from that ball was actually making red and blue. I saw interesting red and blue colors. Out of that eye, and cried and went home, as I recall. But nonetheless, that was an example. Maybe you've had the experience of having some really cold hands. You know, it's been wintertime and you didn't have your gloves on, or maybe you got in a snowball fight and got them soaked with water and anything. So you go inside and you think, well, I'm going to warm these up. I'm just going to put them in some lukewarm water. And what you got out of the deal was a pain sensation. You know, and normally sticking your hands in that particular temperature of water would not have been painful, but it actually hurt. Or maybe it was lukewarm, but maybe it felt even colder than normal. Maybe you've had those kinds of experiences. So if we exceed certain physiologic limits, we can't have a sensory receptor that responds to a stimulus that normally does not excite that particular kind of receptor. But again, under normal situations, sensory receptors are very stimulus specific. Amber?
Like when you have a migraine, sometimes light causes pain. Like if it's too bright in the room, or if like there's too much sound or whatever. Is that related at all, or?
I don't know how that works, but my wife suffers from migraines occasionally, and I do know that she likes to get in a real dark room when she's trying to sleep off a migraine, because somehow that kind of keeps the thing going. If she has a light stimulus, it's painful to her, but I don't know exactly what the central connections of that are. Okay. Let's take a look at how sensory receptors are classified. If we take a look up here at this graphic, we can see that we can group them into what we call photoreceptors. I bet you can look at that name and figure out what particular stimulus excites them. What would that be? Light. And this next one down here is chemoreceptors. They would require certain chemical kinds of stimulation. What would the chemoreceptors, what spatial senses would the chemoreceptors be involved with? Anybody? Starley?
Taste.
Taste and Adam?
Smell.
Smell. Sense of taste and smell. You bet. Thermoreceptors are those that respond to temperature change, various temperatures. And it's interesting, there are certain thermoreceptors that generate impulses when they're warmed up. Other thermoreceptors generate impulses when they're cooled down. So it's not the same receptor that's doing the different temperatures. Mechanoreceptors, that's a pretty large group. A lot of different sensory receptors fall into this particular category. And these are the receptors that respond to movement of some kind. That might involve stretching, it might involve pressure, it might involve vibrations. There are a lot of different kinds of mechanoreceptors. The ones that are called nociceptors, or sometimes you'll see it written nocireceptors, are ones that give us the sensation of pain. And these are probably chemoreceptors when you really get down to the fine-tuned analysis, because when you have certain kinds of tissue injury that you consider to be painful, certain chemicals are released from those tissues, and those chemicals are detected by those pain receptors, and thus we get the sensation of pain. Now, even though we had 5 categories up there, I want you to realize those are just broad groupings. In the photoreceptors, for example, there's going to be rod cells and cone cells. You know, and in the thermoreceptors, we got the group that responds to heat, the group that responds to cold, and so forth and so on. So there's a lot of specific individual receptors. There's probably about 15 to 20 major kinds of sensory receptors in the body. A lot of them are located in the skin, and of course you're aware of where some of the other ones are located as well. I just want to show you something. Let's go to the overhead camera for just a minute. Let's pretend like this is a tongue. We better label it so we recognize what it is. I don't know if you've had this experience or not, but this would be a good one for you to play with in the kitchen this evening. You can sprinkle sugar over your tongue, but you detect the sweetness primarily right out here at the tip. So the taste buds that are out there at the tip of the tongue are the ones that give us the, quote, sweet sensation, the ones that generate impulses that we're going to interpret as sweet. Back here along the sides, along each side, is where the ones that respond to what we call the taste sensation of sour. I don't know if you've ever gotten something in your mouth that was really sour. I mean, more sour than you really would like. And I don't know if you've noticed that you have a tendency to roll that thing toward the middle of the tongue. You know what I'm talking about? Salt and vinegar potato chips are like that for me. You know, I get them in there, I kind of like them, but I tend to kind of get them away from these edges because it's just a little bit more than I really want at the moment. If you sprinkle salt over your tongue, you'll actually be able to detect that the strongest kind of all along the front and sides. It's kind of an overlapping area that takes in the area of sweet and this area of sour. So salt is all along the sides here. And then back in this region, back in here, way back in the back, is the general area that responds most strongly to the taste sensation that we call bitter. In other words, if you've got something that's bitter, you'll notice it when it's back here. Out here on the tip of your tongue, you'll have very little indication that it's bitter at all. Now, those are the 4 taste modalities. I didn't write them all down, but sweet, salt, sour, and bitter. You know that we can detect lots of different odors. So we have a lot, you know, the sense of olfaction or sense of smell is very highly refined. Of course, it's not as refined as highly in humans as it is in a lot of other mammals. But even though we only have 4 basic taste sensations, we've got a lot more specific odors that we can detect, and a very large component of what we call taste is really sense of smell kind of combined with it. And you've probably had the experience of having a real bad head cold sometime and have noticed that you don't taste food with, most food tastes kind of bland or tastes kind of flat when you have a real bad head cold because you may be so stuffed up that your olfactory mucosa, the sense of smell, is not working nearly as well as normal. Did you have a question, Amber?
Yeah, I was just wondering if, like, your taste buds kind of, you get more of them as you grow older, like little kids. Do they have, like, the same, like, sensations in their mouth as we do?
You know, when I see my granddaughters eating jalapeno peppers and not even watering up here, I wonder, you know, what happened, because I can't take some of those kinds of things. But I don't know the answer to that. That's a good question. I just don't know. Starley?
Which one of these receptors handles touch? Is it mechano because of the movement?
Mechanoreceptors handle touch.
And then why is the sensation of plugging your nose so you can't taste, if those receptors are in your nose and receptors are on your tongue are different, Then how come people, when they want to eat something that they don't really like, plug their nose?
Somehow, there are some of the chemicals involved with materials when you have it in your mouth actually make it up into some of the gases and so forth, at least, actually make it up into the back part of the nasal cavity, which all you have to do is go back over the soft back part of the soft palate. Now, if you stick your tongue up against the roof of your mouth, it feels kind of firm until you get back so far, and then it gets kind of soft and floppy back there. That's the hard palate in front and the soft palate. Anyway, you go around the back side of the soft palate. I'm not suggesting you try to do this with your tongue right now. But if you go around the back of your soft palate, you can get above the soft palate. Actually, that's the nasopharynx back there, and there's some olfactory receptors in that region. So, sure. All right, that's the main things that I want to talk about in regard to sensory receptors. There's a lot of different specific ones, and we're going to mention some of these in particular when we get to different areas. When we talk about the eye, for example, we'll talk about rods and cones and a little bit about how they work. When we get to the ear, we'll talk about some mechanoreceptors that are called hair cells that are involved in detecting vibrations and movements of fluid that are going to be involved in the hearing and equilibrium process. So just wanted you to make sure you know what a sensory receptor is. It transduces some form of energy into a sensory impulse and then transmits that impulse to the sensory neuron, which carries it on into the CNS in the brain or spinal cord. Any other questions regarding that brief introduction to sensory receptors? All right, let's go to the overhead camera. I want to define a reflex. You've seen this word before, probably in your reading. What do we mean by a reflex? Anybody want to try that? Bryce.
The body's natural reaction to a stimuli.
Natural reaction to a stimulus, that's not bad. It implies that we're going to do something when some sensory information comes in. Now, you can have sensory information come in and not do anything, okay? But if you kind of automatically do something in response to a certain piece of sensory information, we're going to call that a reflex. Let's put up the definition on a graphic and actually look at it here. A reflex is a motor response to a sensory stimulus. So, if I step on a thumbtack with my foot here, what am I going to do? Probably. You know, it's unsuspected. I didn't do it on purpose. What am I probably going to do?
Lift your foot up.
I'm going to lift this foot up. You know, I'm going to hop off this foot and probably put my weight over here on this other one. That's just a natural thing that we have a tendency to do. If somebody comes up behind you and pricks you with a pin, you have a tendency to pull away from that noxious stimulus. If you grab a hold of a hot skillet, you turn loose of it, you do something in response to that particular stimulus. And I want to go through the basic components of this reflex arc, it's called, that involves the sensory information coming in and then motor response, motor impulses and a skeletal muscle, in this case, response going out. Let's take a look at this graphic for a moment. It's a little bit complex, but I think you can follow it along. There are these three basic components to what we call a reflex arc. We have a sensory pathway up here, and that sensory pathway is going to involve a sensory receptor, and then it's also going to involve a sensory neuron. Now, I put synapse in here in parentheses because between the sensory receptor and the sensory neuron, we're going to have a synapse. So this generates the impulse, and it synaptically transfers that to the sensory neuron. The sensory neuron is going to carry that impulse on into the brain or the spinal cord. When it gets into the brain or the spinal cord, the sensory neuron is going to synapse with a motor neuron, and this begins then the motor pathway. The motor neuron is going to carry that impulse out of the brain or spinal cord, and when it gets out of the brain or spinal cord, it's going to synapse with muscle cells that are involved in the actual effector down here. And so we're going to get some kind of a movement in response. So the three components are the sensory pathway, the motor pathway, and then the actual effector that does something. And in the sensory pathway, we got the two things, sensory receptor and sensory neuron. The motor pathway is the motor neuron, and then there will be a synapse between that and the, in this case, muscle cells that form the actual effector that actually does something in response. Now, when we have this kind of exact pattern, the reflex is called a monosynaptic reflex, although if you count the number of synapses that we had on that table, how many were there?
Three.
There were 3. Well, why is that particular pattern called a monosynaptic reflex if there are 3 different synapses on it? Well, let's go back. Can we go back to that particular graphic that we just had up? Let's pop that same graphic back up again. When the physiologists are naming reflexes monosynaptic or disynaptic, they only count the number of synapses that occur between neurons. So we have only one synapse that actually is occurring between neurons. Sensory receptors up here are classically not neurons. They generate nervous impulses, but there's only one synapse between neurons, so this is called a monosynaptic reflex. The knee-jerk reflex that was demonstrated on that pre-taped video segment that we looked at just a little bit ago is a classic example of a monosynaptic reflex, where the sensory neuron goes straight down to the motor neuron and synapses directly on the motor neuron. Now, a disynaptic reflex is just exactly like what we had diagrammed, except there's actually another neuron between the sensory neuron and the motor neuron. From your reading, does anybody recall what we call a neuron that's between 2 other neurons? Interneuron. Thanks, Susan. So what we have is a sensory neuron, then an interneuron, and then the motor neuron. Most of the reflexes, spinal reflexes in the body, are disynaptic because we've got an interneuron. So we have 2 synapses between neurons. At any rate, that's, I want to make sure that we covered what we're talking about and everybody understands what we mean by a reflex. Any questions on reflexes? The rest of the time today I want to dedicate to the autonomic nervous system. Let's go to the overhead and review a couple of things. We've briefly mentioned this before, but it's been a time or 2 back. ANS is the acronym for autonomic nervous system. Now, by autonomic nervous system, we are talking about the motor output three kinds of involuntary effectors. Do you remember what those are? Can anybody think of one of them? Go ahead, Seth.
Cardiac muscle.
Cardiac muscle tissue. Another one, somebody. Amber?
Smooth muscle tissue.
Smooth muscle tissue. And the last one, Adam?
Glandular epithelium.
Glandular epithelium. I'm just going to write EPI, period, for epithelium. So this is the part of the nervous system that's motor to cardiac muscle tissue, smooth muscle tissue, and or glandular epithelium. Now, by definition, we're not talking about any sensory pathways, although certainly there are sensory pathways coming back from those kinds of structures in the body. But by definition, the ANS is just the motor output to those particular involuntary effectors. Let's take a look at a graphic that says a little more than what we just said in regard to the ANS. It's a functional subdivision of the nervous system composed of those parts of the CNS and PNS that are motor to those involuntary effectors. Not an anatomic subdivision. You can't point at parts of the nervous system and say, well, that's the autonomic nervous system, and this is the central nervous system, and this is the peripheral. No, it's a functional subdivision, and that's an important thing to remember. I think we made that point probably the other day. I know we've harped on it, but I just want to make sure you understand. Once you say central nervous system and peripheral nervous system, that's all the nervous system that there is, but we can talk about a subdivision within those, and that is the autonomic nervous system. And that's an important thing to remember. I think we made that point probably the other day. I know we've harped on it, but I just want to make sure you understand. Once you say central nervous system and peripheral nervous system, that's all the nervous system that there is, but we can talk about a subdivision within those, that together from some parts from the CNS and some parts from the PNS make up what we call the autonomic nervous system. Now let me show you what makes the autonomic nervous system so unique. Let's go to this overhead camera, and we're going to draw a circle up here, and we're going to say that's the brain. So that's going to be the brain today. I think I used something like that in the second grade for a sun, but I put some little things out here on it. But, all right, now we're going to come down, and we're going to say that's the spinal cord, all right? If I've got a skeletal muscle tissue out here, now skeletal muscle tissue is a voluntary effector. Depending on where this skeletal muscle tissue is located, maybe it's in a muscle up in the head region. If it's up in the head region, the motor neuron that's going to go to that skeletal muscle tissue, its cell body is going to be someplace up in the brain, and its axon is going to come out and go all the way to that skeletal muscle tissue and synapse there on the skeletal muscle tissue. If this particular skeletal muscle tissue is in a superior or inferior limb or something like that, the motor neuron is going to be located someplace here in the spinal cord, and the axon is going to go all the way to that skeletal muscle tissue and then synapse. Now, what I want to point out is to get to this skeletal muscle tissue, which is a voluntary effector, it's a single neuron coming out of the brain going all the way there before it synapses, or coming out of the spinal cord and going all the way there before it synapses. On the other hand, and I'm going to write the word I-E right here. If we're talking about an involuntary effector, smooth muscle tissue, cardiac muscle tissue, or glandular epithelium, there's a neuron that comes out of the brain or spinal cord, yes, it's headed for that, but it doesn't go all the way there. It only goes part of the way there. And then what it does is it synapses on a second neuron. And that second neuron continues the rest of the way to the involuntary effector. This is what we mean when we say that the autonomic nervous system is a two-neuron chain from the central nervous system, brain or spinal cord, out to the involuntary effector. The impulse actually has to pass through two different motor neurons. Now, does anybody remember what we call that first neuron? Starley?
Preganglionic neuron?
Preganglionic neuron. Preganglionic neuron. I'm just going to write preganglionic in, okay? Preganglionic neuron. That's the first neuron of the two that are involved. These are in a linear series. This second neuron is called the postganglionic neuron. I'm going to write P-O-S-T. I'll try to sneak it all in there, but it's getting kind of small, isn't it? Sorry about that. It's also sneaking off the edge on me. Postganglionic neuron. So we have a preganglionic neuron and a postganglionic neuron. These are both multipolar neurons. Does anybody remember what functional type of neurons they are? So they're multipolar because they're motor. Remember the four functional types of neurons? We had somatic efferent and visceral efferent, and so forth. What are these?
Visceral
Right?
efferent.
These are visceral efferents. These are preganglionic and postganglionic neurons are both visceral efferent neurons. Those are the ones that carry impulses out to smooth muscle tissue, cardiac muscle tissue, and glandular epithelium. Now, you may ask yourself, and probably should at this point, why? Why do we have this two-neuron chain if we can get impulses out to skeletal muscle cells with just a single neuron from the brain or the spinal cord? Why is there a two-neuron chain if the destination is going to be some involuntary effector? And it kind of boils down to this. We can go back to that overhead camera for just a minute on this same drawing that we just made. When each preganglionic neuron comes out of the spinal cord or brain, some of them are up here and some of them are down here, it doesn't synapse on just one postganglionic neuron, but its axon actually branches several times and synapses on a whole bunch of postganglionic neurons. And all of these postganglionic neurons head for that same involuntary effector. In other words, one preganglionic neuron synapses on several postganglionic neurons. And the net result or effect of that phenomenon is that a relatively small number of motor impulses leaving the central nervous system from the brain or spinal cord can actually result in a large peripheral response out here in the involuntary effectors. What this kind of means for us is we don't have to think about this because it's kind of happening at the subconscious level. It's autonomic. It's below the conscious level of the nervous system. Now, think about the kinds of things that smooth muscle tissue and glandular epithelium do and so forth, and realize how inconvenient it would be. Let's say you're working out in the weight room and you're really getting overheated, and then suddenly you remember, dang, I forgot to sweat. You know? In other words, it happens automatically. You sweat when you overheat automatically. When you need to have your heart rate go up, you don't have to think about it. It goes up automatically, okay? When you need to do this or that involving smooth muscle tissue, cardiac muscle tissue, and glandular epithelium, it simply happens. And so that's the big advantage. I call that the multiplication effect, a chain letter effect. You know, the chain letter where you're supposed to sign your name on the bottom or something like that and send it to 5 other people, and then in 3 weeks you'll be a multi-billionaire or something like that. You know, the deal. And if everybody followed through, of course, it would work, but, you know, most of us just put those things in the trash. Anyway, single preganglionic neuron synapses on a bunch of postganglionic. How many? 10, 20, 30 postganglionic neurons are controlled by a single preganglionic neuron. That means when an impulse comes down that first neuron, it synaptically stimulates all of these second neurons, these postganglionic neurons, and so all of those then head for that same involuntary effector, and we can get a large peripheral response with a minimal amount of output from the central nervous system. Another advantage that has been proposed for the autonomic nervous system is the fact that some postganglionic neurons can actually have excitatory inputs and then other inhibitory inputs on the same final pathway. And you can imagine some of the advantages of that particular phenomenon. Let's say you're sitting here, and we've been filming for a while, and you suddenly discover that your urinary bladder is sending you sensory impulses saying that I'm full and I need a place. You know, we need to go to one of those places. It's kind of convenient to be able to send the message back and say, hang in there, because we're not quite done yet, see? And so you can have excitatory and inhibitory influences on the same final pathways with this very conveniently. Now, I want to go back to that overhead for just a second, and I want to draw, again, this first neuron synapsing on second neuron, continuing on. These are all multipolar neurons. The group of number 2 neurons that occurs in a cluster here, those groups of second neurons, cell bodies, of course they all got their axons continuing on, but that group of neuron cell bodies making up that bunch or group right there is called a motor or autonomic ganglion. So in all autonomic pathways in the body, we have this same general pattern. Preganglionic neurons coming out of the brain or spinal cord, synapsing in motor ganglia with postganglionic neurons, and then these continue on and ultimately synapse with the involuntary effectors. That's the general pattern. And that's really the essence of the autonomic nervous system. Now, these motor ganglia, I want to talk about them for just a second. There's actually kind of 3 groups of them in the body. There are groups of those autonomic ganglia out along what we call the sympathetic trunk, and we call those sympathetic trunk ganglia. Let's go to the overhead for this. Motor or autonomic ganglia, we'll title this. So we got them along the sympathetic trunk, and we're going to see the sympathetic trunk in just a second. There's a left one and a right one. I'm just going to write GAN for ganglia, okay? There's sympathetic trunk ganglia. Those are big enough to see, and they're located along the left and right sympathetic trunks. We also have some motor or autonomic ganglia that are too small to see. They're microscopic, and they're located kind of in the walls of the organs innervated. So the preganglionic neuron goes all the way down to those particular organs. Those motor ganglia are called terminal ganglia. And a third general group of them are big enough to see. They're not along the sympathetic trunk, and they are given individual names. And they're found in the head, neck, and thorax and abdomen. I just call those named ganglia. Individually named, like celiac ganglion, otic ganglion, pterygopalatine ganglion. There's a whole bunch of them that we don't need to know specifically. But all of these are autonomic or motor ganglia. All right, let's take a look at the sympathetic trunks. And I want to pull up a model that we've seen before, and I want to put it up here on the overhead camera. So we pop to the overhead and look down on this. This is a spinal cord coming right down here. Here's the brain up here. This is a spinal cord. The vertebrae have been chewed away so that we can get into the vertebral canal. And these are the spinal nerves coming off the spinal cord in these locations. And we remember from a previous session, we said a spinal nerve, once it emerges, basically has two branches, an anterior branch and a posterior branch. Well, coming off the anterior branch is a little short branch that comes down to the sympathetic trunk. So this thing that's kind of yellow along here with the pink globs along it on this particular model, that's the sympathetic trunk on this side. There would be the same thing over here, but they removed it for purposes of getting a clearer view of the spinal nerves over there. These pink globs actually are sympathetic trunk ganglia. That's where the number 2 neuron cell bodies in the 2-neuron pathway here would be located. So these are all sympathetic trunk ganglia. So those are just examples of autonomic ganglia. Now I want to show you how that works from a transverse section of the spinal cord that we looked at before. So I want to go to the overhead camera again, and I want to draw a transverse section of the spinal cord. Let that be the central canal. This be gray matter. This be white matter. And then we'll say that here's the posterior rootlets. Here's the posterior root of spinal nerve. There's the sensory ganglion. Okay? And here's anterior rootlets, anterior root of the spinal nerve. And then when these two roots come together, we've got the actual spinal nerve. And it divides into a posterior branch and an anterior branch. Now, coming off the anterior branch, very shortly after it branches from the main nerve here, there's a little tiny branch that comes down to the sympathetic trunk. So we'll pretend like that's the sympathetic trunk on this side. I'm just going to write ST for sympathetic trunk. The name of this branch that comes off the anterior branch to come down there is the ramus communicans. Ramus communicans. I'm just going to write COMM for communicans. It means communicating branch. That's what that means. And so preganglionic neurons, to get to the sympathetic trunk, they'll actually be located up in here, about in here on the gray matter of the spinal cord. They will come down, their axons will go this way and go down the ramus communicans to get into the sympathetic trunk. There they can synapse on postganglionic neurons, or they can actually pass on through that sympathetic trunk and come out here to some other ganglion someplace else in the body and do their synapsing on the number 2 neurons. Regardless of where that synapse occurs, there has to be a synapse between a number 1 neuron, preganglionic neuron, and a postganglionic neuron. At any rate, that's what the sympathetic trunk is on either side here. It's actually a series of interconnected autonomic ganglia that parallel the spinal cord, but of course much smaller in diameter than the spinal cord itself. All right, let's go back and take a look at some graphics that are going to summarize some of the things that we've said, make sure we catch ourselves up here. The first preganglionic neurons, the first neurons, have their cell bodies in the brain or spinal cord, and there are axons that are carried on out to autonomic ganglia that are located in the PNS. So the cell bodies are in the brain or spinal cord, but the axons leave the brain or spinal cord and are carried out into the PNS, where they synapse on the number 2 neurons within the motor ganglia. And if we go to the next graphic, we can see that the second or postganglionic neurons in the 2-neuron chain have their cell bodies in autonomic ganglia, and when they're stimulated by preganglionic neurons, they carry motor impulses on to the various involuntary effectors. So it's the second neuron in the 2-neuron chain is the one that actually synapses with the involuntary effector. And we made the point a while ago that's summarized on this next graphic. We'll take a look at it. Each preganglionic neuron synapses with several postganglionic neurons. So we get that multiplication effect. Starley.
Sorry, I just had a couple questions. You showed the motor impulse going out of the anterior root. Are all the motor impulses on the anterior root?
Let's go to the overhead again, see if we can answer Starley's question. If this is the spinal cord and we've got the anterior root here, posterior root here with the sensory ganglion on it, it turns out that, and of course these are the branches of the spinal nerve, it turns out that the anterior root of a spinal nerve, Starley, is almost 100% motor fibers going out of the spinal cord. And the posterior root is almost 100% sensory fibers coming in. So the impulse transmission direction is here and here. Coming in the posterior root, going out in the anterior root. But when we get out here into the branches of the spinal nerve, it's both directions. This is a two-way street, and this is a two-way street. Both sensory and motor fibers are carried by the branches. So there's a mixing then that occurs in here. Does that make sense? Mm-hmm. But these are kind of like one-way streets. Motor going this way, sensory going this way.
Thank you.
Sure. Now, the autonomic nervous system is divided into two major components, two major subdivisions, if you will. And those, anybody know the name of those? Anybody remember from your reading? What are the names of the two subdivisions? Bryce?
There's a sympathetic and parasympathetic.
Sympathetic division of the autonomic nervous system, sometimes called sympathetic part of the autonomic nervous system, and the parasympathetic part of the autonomic nervous system. So we got those two divisions. Now let me show you the biggest single difference. Well, there's actually about 3 different kinds of differences with them. Let's go back to the overhead and take a look at our schematic that we had up here. I just want to show you the 2-neuron chain again. And again, we'll use IE for involuntary effector. The neurotransmitter that is actually used at this synapse, at the synapse between the preganglionic and postganglionic neuron, is acetylcholine. It's a chemical called acetylcholine. That's what's used at the ganglia. But when we get out here to the involuntary effector, there's basically 2 major different ones that are used. Some pathways going to certain involuntary effectors use acetylcholine again at this second synapse. Other pathways use norepinephrine. Now, norepinephrine is actually a hormone as well. It's one of the adrenalins. And autonomic pathways that use acetylcholine at both synapses, that's characteristic of what we call the parasympathetic division. If acetylcholine is used at both places, it's here and here as a neurotransmitter. But those pathways that use acetylcholine at the first one but use norepinephrine at the second one, those are sympathetic pathways. So there's that difference in the neurotransmitters. Both of them use acetylcholine at the first synapse, but they use different neurotransmitters at the second synapse. Another difference between what we call sympathetic and what we call parasympathetic is kind of the overall functions or responses that we get in the body. The sympathetic division has sometimes been called the fight or flight division because the kinds of changes that occur in smooth muscle tissue, cardiac muscle tissue, and glandular epithelium are the kinds of things that happen in your body when you get mad or scared. So let's think about some of those things. What happens to your heart rate when you get mad or scared? What's it do? It goes up. What about the pupils of your eyes? Do they dilate or constrict?
Dilate.
They dilate. Same thing happens to your respiratory passageways. They dilate. Those are mad, scared type responses. You know the goosebump thing? When you get piloerection, you know, like when you're chilled, or when you hear a noise you don't know what it is, you know, and the hair stands up on the back of your neck. That's a mad, scared, a fight or flight type response. The parasympathetic responses overall tend to be the opposite kinds of responses to what we just described. So if we're talking about slowing the heart down, that's parasympathetic. If we're talking about pupillary constriction, that's parasympathetic. If we're talking about bronchial constriction, that's parasympathetic. What about salivary output? You know, how much spit do you produce? When you get mad or scared, what happens in your mouth? You get dry? Yeah, you get dry. Salivary gland secretion is inhibited by a fight or flight type response. So that's kind of the functional difference, a kind of a fight or flight for sympathetic and a kind of a laid-back homeostatic, bring everything back down to normal for the parasympathetic. That's an oversimplification, but it does work. Another difference between the two divisions that I really want you to remember well is that the sympathetic pathways are distributed all over the body, every place. We got sympathetic kinds of things going on. But parasympathetic division of the ANS is kind of limited to head, neck, and trunk regions. Head, neck, and trunk. All right, let's take a look at some graphics that summarize some of the things we just said in regard to the sympathetic and parasympathetic. In the sympathetic division of the ANS, the preganglionic neurons are located in the spinal cord. Preganglionics have their cell bodies in the spinal cord. And we said they're distributed to involuntary effectors all over the body. We get this fight or flight type of a change in those involuntary effectors. Now, if we contrast that parasympathetic division with those same criteria, we'll go to the next graphic that shows that. In the parasympathetic division, the preganglionic neurons, the first neurons, are located in the brain and the sacral part of the spinal cord. Second neurons are always in the autonomic ganglia. And these are distributed primarily to structures in the head, neck, and trunk. And they usually give us changes in the body that are opposite to those of the sympathetic division. We say that the two functions of the two divisions are, in general, antagonistic, because whatever the sympathetic division causes to happen in a certain location, the parasympathetic division tends to cause the opposite kind of thing to happen. Let's take a look at some of the typical locations here on a graphic of some autonomic effectors. You know that the heart, cardiac muscle tissue is one, and under the influence of sympathetic impulses, the heart rate increases. It also contracts with more vigor as well. Under the influence of parasympathetic stimulation, the heart rate decreases. We've already talked about what happens in the pupil of the eye. Under parasympathetic stimulation, the pupil of the eye dilates, gets bigger, and under parasympathetic stimulation, it constricts or gets smaller. The bronchial passageways, the air-conducting passageways, dilate in response to sympathetic stimulation, and the bronchi constrict in response to parasympathetic stimulation. We mentioned how salivation is inhibited or decreased by sympathetic stimulation it increases under parasympathetic stimulation. Now, sweat glands secrete under the influence of the parasympathetic division. There's no effect with parasympathetic stimulation simply because parasympathetic pathways don't basically go out to the superficial parts of the body at all. They're limited to deeper structures in the head, neck, and trunk. Now, although most involuntary effectors in the body receive both sympathetic and parasympathetic pathways going to those, there are a few places in the body that are sympathetic only, and an even shorter list of structures that are parasympathetic only. Let's take a look at the things that are sympathetic only. Sweat glands, piloerector muscles are the ones that when they contract you get goosebumps. They are sympathetic only. The adrenal medulla receives preganglionic sympathetic fibers, but nothing from the parasympathetic division. Vessels to most skeletal muscles are sympathetic only as far as the smooth muscle tissue in their walls, and the pupillary dilator muscle, which we've already kind of mentioned in regard to pupillary dilation, of course, is sympathetic only. Now, parasympathetic only, if we look at this next graphic, structures are not very many. The ciliary muscle of the eye, which controls the thickness of the lens, is, for all practical purposes, parasympathetic only. And the pupillary constrictor muscle, which are smooth muscle fibers within the iris of the eye, that is also parasympathetic only. So those are examples of structures that are parasympathetic only. So there are a few places in the body where only one division of the ANS has an effect, but in most of the involuntary effectors, one more time, they're both pathways are present, and they cause, in general, in most cases, an opposite type response. It's pretty easy to think about what happens to you when you get mad or scared in various parts of your body. I mean, we've all had that experience. And for the most part, the opposite of what's happening there will be what would happen under the influence of parasympathetic stimulation or parasympathetic pathways. Now, let me show you something else. We said that the preganglionic neurons in the sympathetic division were found in the spinal cord, right? Remember that graphic that said that? Specifically, let's go to the overhead for just a second. I'm just going to write sympathetic preganglionics. Now, not only are they in the spinal cord, but I want to get a little more specific. It's not just the spinal cord, but it's specifically the T1 to L2 segments of the spinal cord. There's nothing in the cervical region, and there's nothing in the lower lumbar or sacral region as far as sympathetic preganglionics. And if we look specifically at a transverse section of the spinal cord, and let's just draw the gray matter here. In those regions of the spinal cord, there's a little side swelling on the gray matter. So we got this X or H-shaped gray matter, and a little side swelling. That's actually called the lateral horn or lateral gray column. It's right in here where those preganglionic neurons are located. So we say they're in the lateral gray columns of the spinal cord from T1 to L2. Now that's about as specific as you can nail it down. That gets their address exactly. Spinal cord, T1 to L2, lateral gray column, lateral horn, if you will, of the gray matter. For this reason, because of this location, the sympathetic division of the ANS has been called the thoracolumbar division. You may have read that in your text. Thoracolumbar division. Let me just write that out here. Thoraco, just like it sounds, lumbar division. And that's just an alternative name for what we mean by the sympathetic division. It has to do with this T1 to L2 positioning of the preganglionic neurons. Susan?
How does that relate to the plexus that we talked about, the lumbosacral plexus? Are those the nerves that are involved at all?
Well, coming off the anterior branches of all of those nerves, there are rami communicantes that go down to the sympathetic trunk. So there are preganglionic neurons in the first couple lumbars that come down here.
Right.
Okay. They're not preganglionic neurons coming out of the lower lumbars or any of the sacrals that go down there.
Okay, so this would be the lumbosacral plexus that is involved with these.
Yeah, just the very upper part. You know,
Okay.
lumbosacral plexus is lumbar and sacral spinal nerves, so
Well,
it's just the
that's
very
true.
upper
So
part.
but it would be part.
Would be involved to a limited degree.
Okay.
Now I want to show you one more thing here. When we talked about the preganglionic neuron location of the parasympathetic division, we said they're found in the brain and the sacral part of the spinal cord. It's not just any place in the brain, it's in the motor nuclei for cranial nerves 3, 7, 9, and 10. Now let's go back to the overhead for a second. Let me show you what I'm trying to demonstrate here. So I'm going to just put parasympathetic preganglionics. So their specific location is brain and spinal cord. I'm going to write SC for spinal cord. But here in the brain, it's not just any place in the brain. It's in motor nuclei of cranial nerves 3, 7, 9, and 10. Those are the 4 cranial nerves that carry preganglionic parasympathetic fibers. And it's not just any place in the spinal cord, it's the sacral part of the spinal cord, down in the sacral part. And because of this sacral location of the spinal cord and the brain location here, the parasympathetic division of the autonomic nervous system is sometimes called the craniosacral division. So when you read craniosacral division in your textbook, that's just another way of saying the parasympathetic division, and it gets the craniosacral name because of the brain and spinal cord location of the preganglionic neurons. And I think I'm supposed to pretend like I'm still talking, but the credits are running and he's going to